Hey everyone, Nurse X here, and my wonderful assistant again. We are going to go over some wound care, how to treat different wounds. This is first aid. Remember, these are not nursing skills. These are just simple first aid skills. When to treat at home and when to see a physician. Rule number 1, always don your gloves, always put your gloves on. We want to make sure that we don't get contaminated or pass anything on to anybody else. So gloves, first step of wound care. Okay, so my assistant here, she's got a little wound. It's not major. Some of the things that we're going to need, if you can get some saline wash, great. Typically runs, this is a 7.4 ounce bottle. And this is normal saline. Okay, sodium chloride solution, wound wash, got our antibiotic ointment, bacitracin. We have our roll gauze. And then I've already opened my 4x4 gauze. But you can get all of these things even at the dollar store. You can see I got mine from Dollar General. Tends to be a little cheaper there. So, my patient here has a little wound. It's really a little bigger than that. But we're just going to use her freckle here just for an example. So, this is a wound she got. Little cut, nothing major. We can actually put a Band-Aid on this. But I don't have a Band-Aid for the video, okay? You want to get your saline wash. You want to spray it on there. You want her to be holding her arm down. So when we're cleaning a wound, we want the stuff to try and drain down, okay? If you don't have saline wash, that's fine. You can clean it with warm soapy water, no big deal. I'm going to pat this dry, starting from the inside of the wound and then all the way around. We don't want to go out and then in into the wound because we could be bringing bacteria into the wound that's on her skin. So start in the wound and then you can just pat dry going around. Okay. Now this isn't really a big deal. We're going to use our antibiotic ointment, very small little cut. We're going to put a little bit on there and then we're going to put our Band-Aid on. Okay. You can do that 2 times a day, 1 time a day, just depending on how it is. You might only need that Band-Aid for 1 day if it's not, too deep. When you go to a neck size wound, so this could be like a pretty big gash. I don't know if you've ever run into like the corner of a table or something, really hurt yourself, or your husband's out working in the garage and comes in and he's gashed himself pretty good. So for those, sometimes they tend to bleed quite a bit. We don't want to clean those at first. So we've got quite a bit of bleeding going on here. We want to put a piece of gauze on and we're going to apply compression there, okay? And we don't want to continue to rip this gauze off and check and say, oh, we're still bleeding every 20 seconds. Your body is actually trying to form a clot. So you want to make sure to just put some compression on there for about 5 minutes. If you start to see some more bleeding coming through this gauze, do not take it off and put a fresh one on. You simply want to add another piece of gauze on top of that. Continue your compression. If you see a little bit more bleeding, you can put another one on, okay? Now, if after 5 minutes, this thing is still really bleeding, I'm going to show you what to do in the next step. However, for a medium-sized wound like this, it should pretty much subside within 5 minutes. So you're going to keep your gauze on here. Remember, we don't want to take this off because we don't want to disrupt the clotting process. So that is when we are going to use our Curl-X, our roll gauze, which looks like this out of the pack. And then we are going to take it and just roll it up so that that gauze stays on there. Cut it, and then you can put a piece of tape on there. Okay, the tape they have at Dollar General as well. I don't have any here sitting with me, but that's pretty cheap. Keep this on at least for a couple of hours, and then you can remove this roll gauze That wasn't supposed to fall off yet. And if you have your wound wash, you can saturate that and gently lift it up, okay? If you see that it's adhering to any type of scab or anything, go ahead and spray some more in here. Set it back down, let it soak a little bit, and then bring it up. Or if you just have regular water, that's fine too. You want to make sure that if that gauze is stuck, you're not just ripping it off of there and starting that bleeding process all over again. So now, if she were to come running in the house, she's gotten into a, bike accident, she's bleeding all over the place, and this blood is just not stopping. I am talking about severe bleeding going on here. So we're going to use this again as a guide. Her freckle. Thank God for your freckle. So in severe bleeding, you want to make sure that you have a tourniquet on hand. Mine is like, what the phlebotomist or us nurses use when we're drawing blood. If you don't have a regular tourniquet like this, they make all kinds of tourniquets. And I do recommend going on YouTube on how to make your own tourniquet. But you can even use just a shirt or another piece of cloth. You want to go about 2 inches up above that site and then apply your tourniquet. You then want to get gauze, or really, if this is really bleeding, you're going to be looking at like an ABD pad or a clean towel. And you want to elevate that area up above the heart, okay? When a person has severe bleeding, I also recommend laying them down. It's very easy to go into hypovolemic shock from profuse bleeding. So put your tourniquet on. Get your clean towel, elevate that area, have the person lie down, and then you're going to be calling 911. We never want to try and treat severe bleeding at home on our own. People can bleed out very quickly, guys. So tourniquet on, clean towel, elevate that extremity, lay down, and call 911. Okay? So that was our basic wound care video. I also want to go over looking for signs of infection. So if you have a small to medium wound that we talked about, the first two, say this is our wound. You can get some redness around the wound. And sometimes you'll see this anyway as it begins to heal. But typically, if this is really inflamed and very red, especially warm to the touch, that's a good indication of an infection. You might see a little bit of drainage coming out, like some clear, or possibly a little bit of bloody drainage, which is fine. But if you start to see like pussy, green, or yellow drainage, that could also indicate an infection. If you have a lot of pain, especially if this is a small wound and you're feeling quite a bit of pain around that wound, that's also another indication of infection. You can also get fever, body chills, like flu-like symptoms. So be mindful of that. If you start to have any signs of infection, then you need to be calling your doctor to schedule an appointment. So I hope you guys enjoyed that very quick tutorial for wound care. And if you have any questions, drop them below. Thanks, guys.